Hi there, it's Dr. Jones from Zetland Medical Practice. I wanted to do a video to show you how to use our eConsult system because I know that not everybody is confident with using it. So that's what this is going to be about. So what I'm going to do is just share my screen. So what you need to do is find your internet browser, open that up, and then just type in our website, so zetlandmedicalpractice.co.uk. So you can see here in red, you can click this button and you'll start an eConsult, or there's also this blue banner here that you can click. So I'm going to click on here. So you can either choose an adult health problem, you can put a child health problem, so if you're filling it in for your child, you can ask for sick notes and an admin help, or you can actually do your annual review, so things like contraception, HRT, depression, there's quite a few things on there. But what I'm going to show you today is how to ask about a new health problem. So let's say adult health problem. So you can search down and you could find your problem, or you can search for it. So I'm going to say that I have a sore throat. And you can see that it gives you several options to pick from. Not everything is on the eConsult system, but obviously by picking the closest one, you will make the questions more logical for the problem that you're ringing up with. So I'm going to click sore throat. So obviously, because I've picked sore throat and this is potentially something the pharmacist could deal with, they're saying maybe it's worth speaking to them first. But let's pretend I've already spoken to the pharmacist and they've advised GP. I'm going to say I still want to contact my GP practice. So it's just essentially saying here that if you have something very urgent, then this might not be the most appropriate system, and that we understand that. So we do understand that. Next step. So as I said before, you can do these forms for yourself, for a relative, so that could be good if you're a carer or if you have an elderly relative who doesn't know how to use these sort of systems, or a child, but I'm going to say it's for myself. So this is kind of a screening set of questions to make sure that you're not life-threateningly ill, because obviously this is not appropriate. It's not an appropriate way to contact us if you're having any of these things. So signs of a heart attack, stroke, etc. Clearly, if you have these, you need to call 999. So what I'm going to say here is I'm not experiencing any of these symptoms. You can log in here with the NHS app, but you can also just continue without logging in. Are you registered at our practice, at Zetland Medical Practice? Yes. And what was your sex at birth? So for the purposes of this, I'm going to say male because I'm going to use our test patient to submit this form. So we'll say male. So I'm going to pop in his date of birth there. There we are. So in a few words, tell us how we can help. So here you can write anything you want. So it may be that you say, sore throat over a week. I've had tonsillitis before. You have to excuse my spelling and typing. And I think I might have it again. Okay, obviously you could write more there, but I'm not going to bore you with my typing. Have you tried anything for this? You could say yes, you can write in there. So it might be that you've tried painkillers from chemist or whatever you want to write. Any particular help you would like? So again, you might say, yes, I think I need antibiotics, because often by the time people are coming to us, that is what they feel they need. Most people are pretty sensible and have done the basics first. So describe your symptoms. So again, depending on how much you've written in the beginning, it might be that you need to say sore throat, cough, runny nose, feel tired and run down, or whatever you want to. I'm really showing off my typing today. Right, next step. Are you breathing harder or faster than usual? So what these are some sort of, call them red flag questions, because obviously if I'm panting, I'm potentially seriously unwell and it may not be appropriate for me to be doing an e-consult. So if I was to answer yes, it would probably stop the e-consult and ask me to phone the surgery or phone 111, because that would imply that I need immediate attention rather than waiting for a response on an e-consult. So I'm going to say no. Have you had a high temperature? I'm going to say no. Have you had bad chills, excessive sweating? No. Are you currently taking chemotherapy? No. Does your skin look blue, mottled or pale? No. Have you suddenly become confused? So these are all these red flag questions I was talking about. Have you passed urine in the last 12 hours? I'm going to say yes. Have you been able to drink fluids? Yes, I am. Have I had quinsy before? Now, this is a good example about how clever the system is. So quinsy is an abscess at the back of your throat. So it's sort of like a extreme version of tonsillitis. So what they're doing here is looking at your risk of that. Now, clearly, if I'd picked abdominal pain rather than sore throat, it wouldn't ask me if I'd had quinsy before. So it cleverly picks out questions relevant to what you've said is wrong with you. So basically, we're going to say no to that. How long have you had a sore throat? I'm going to say more than 3 days. And how long have you had this for? Let's say 5 days. Next step. Can you see any white spots at the back of your throat or on your tonsils? Let's say yes. And do they look red or raw? I'm going to say no. Cough or cold? Yes. And how long have you been coughing for? So again, more than 3 weeks would be more worrying. We'll say less than 3 weeks. Are you coughing up any mucus? No. Blood? No. Do you have a hoarse voice? No. Any difficulty speaking or opening your mouth? So depending on the answers, sometimes if it's very serious, like the panting question, it would just end the e-consult, but other ones, it wouldn't end it, but it would flag it to us as an urgent e-consult, which means that we need to respond within 24 hours, whereas the non-urgent, we have 5 days, although I will say we generally get back to you, at least at Zetland, within 24 hours, but if we were very, very busy, obviously we would potentially answer the next day with the ones that we have 5 days to respond to. So difficulty speaking, we're going to say no. Developed a red rash. So again, this is very clever. This is to do with the fact that it's a sore throat consultation, so they're thinking about scarlet fever. And again, this question would not appear if I'd picked a different problem that I was presenting with. It just shows you how clever it is. So we're going to say no. And the diabetes question is to do with how vulnerable you are to this infection becoming more serious. I will say no. So I love this actually. You can upload photos. This is really helpful. I've actually used it for people with tonsillitis. So if their questions very much sound like tonsillitis, so high fever, pus, those sorts of things, and then they upload a picture of clearly very infected tonsils, it may be that I just phone you and we do antibiotics, or potentially even just prescribe and let you know that that's what's happened with a safety net of what to do if things don't improve, because I may have all the information I need to make that diagnosis. It's also really helpful for sort of skin problems, skin lesions. I'm not saying that we won't necessarily ask you to come in, especially if the photos are not clear, but potentially you can avoid coming in by giving us this additional information, which as somebody who works, as people with caring responsibilities, you know, that's just so much more convenient than having to always come to the surgery. Although obviously we're happy to see you if you want to come to the surgery. So we're going to skip this because obviously I don't have any pictures in this case. So anything else you want to tell us? So it might be that you've forgotten something at the beginning, or there might be something else you feel is relevant. I'm going to say no. And this is just some screening health questions. So we're going to say no to that, and that I've never smoked. And let's just say that yes, I do have an allergy. And then you could write it here. So it might be that you have a penicillin allergy, and then it just makes the doctor aware, just an extra reminder to us. We'll have it on your notes, but at least then we're seeing it when we're reading through the e-consult. Anyone in your household had COVID? No. First name, so I'm going to put in the name of our test patient, which I'm pretending to be. So Mickey Mouse. So we'll put in the postcode of the surgery. And medical practice. Oops. Town or city. There we are. Next step. Contact phone number. So obviously I'm not going to put in a new number. I think that's the right number of zeros. Here we go. Email. So that's just to confirm. Obviously just making up an address here. Okay. Next. And then I quite like this as well. So you can say how you want us to get back to you. So it might be that you're working and you don't want a phone call, you want it to be a text message or an email. The only thing I would say is that if it's inappropriate to use your preferred method, we won't do that. So for example, if you've put in a depression eConsult and you've said that you're suicidal, I'm probably not going to text you, I'm going to call you. And that's just because it wouldn't be appropriate to sort of have that conversation via text. But I do always look at this, and if someone has said a particular way, if it's appropriate, then I will use that way to contact you. But I'm just going to say no preference here. Is there a particular person? So within reason, we will try and give it to that person. So this might be relevant if I've been caring for you and then you want to update me on something, or you've developed a new symptom, or maybe you just have a preferred doctor or person at the practice that you want to speak to. So you can say yes and then write the name. The only thing I would say is that obviously I work part-time. If I'm not in and you need to be spoken to, then obviously somebody else will call you. So we're not guaranteeing it'll be that person, but certainly within reason, we will try and pass it to that person. So you can choose to have a copy of your consultation sent to you, and you can also do a survey. I'm going to skip these things. And there we go, it's gone to the surgery. So I'm doing this on a Tuesday. Because of the answers that I've put in, it's decided that I need to be spoken to within a day. So obviously the surgery will get back to me within a day. And that's it. It's gone now, and then I'll get contacted. So I'm going to stop sharing. And hopefully that is helpful for anybody wanting to use the eConsult system. I hope it gives you the confidence to do so. It should be online between 8 in the morning and 6 o'clock at night. It's not on when we're not open. And what I might do is sort of show you in another video how to submit sort of your annual reviews or admin requests. But I think once you have the confidence to try it, you'll realise it's actually an excellent system for contacting the GP. Okay, I hope that was helpful. And we look forward to seeing you soon.